Introduction to the NCLEX exam. Hello everyone, welcome to BrainBooster Nursing Hub. In today's video, we will learn about the NCLEX exam, including what it is, who needs to take it, and in which countries it is required. We will also discuss the different types of NCLEX exams and how the exam works. By the end of this video, you will have a clear understanding of the NCLEX and its importance for nursing professionals. Let's get started. NCLEX stands for the National Council Licensure Examination. It is a standardized exam that nursing school graduates must pass to become licensed as a registered nurse NCLEX-RN or a licensed practical vocational nurse NCLEX-PN in the United States and Canada. The exam is developed and administered by the National Council of State Boards of Nursing, NCSBN, to ensure candidates have the entry-level knowledge and skills to provide safe, effective patient care. Now, let's learn about the two primary types of NCLEX exams. NCLEX-RN, taken by graduates of associate's or bachelor's degree nursing programs to become a registered nurse, RN, and Bachelor of Science in Nursing, BSN programs. It focuses on care management, assessment, and physical sciences. NCLEX-PN, taken by graduates of practical or vocational nursing programs to become a licensed practical nurse, LPN, or licensed vocational nurse, LVN. It focuses on care coordination and data collection, how it works. Unlike traditional written tests, the NCLEX utilizes computerized adaptive testing, CAT. As you answer questions correctly, the computer adapts and gives you more difficult questions to measure your competency. If you found this video helpful, please like, share, and subscribe to BrainBooster Nursing Hub. Thank you for watching.